Hey, welcome back to Daybreak Live. I'm Jibadell Abrams. We're joined this morning by Dr. Rick Redmond and Morgan Ragsdale from Redmond and Casey Family Dentistry, soon to be Southern Smiles of Sylacauga. Good morning to you both.
Good morning.
Both of you smiling broadly this morning. And Dr. Redmond, we'll start with you. A little bit about your background and how long you've been in Sylacauga and where are you?
We're right next to the hospital, and I graduated from UAB Dental School a little over 28 years ago, and my great uncle, Dr. Morris Hollis, was practicing here in town, had been for a long time, and he was ready to retire. And that's how I ended up in Sylacauga buying his practice.
So how did it become Redmond and Casey Family Dentistry?
Well, we've been blessed at the office, and about 3 years ago, I knew I needed to expand the office, and about the time I was ready to start construction to expand it, I found out Dr. Casey, who was from Hollins originally, was about to graduate from dental school in the next year and wanted to come back to this area to practice.
Well, no doubt the dentistry has grown by leaps and bounds. And Morgan, welcome to you this morning. I've heard a lot about implants. I've heard about implants. I've heard about mini implants. Tell us a little bit about where you are in this process.
I am the implant coordinator for the office, so I'm the first face that the patients will meet. I bring you in for a free consultation, and we can take a hospital-grade CT of your mouth to make sure that you are a candidate for mini implants, and just kind of give you all of your options.
Dr. Redmond, how does this work?
Well, the first step is getting a CT to make sure we have enough bone to work with, and most of the time, because these implants are smaller diameter, that there is enough bone. And then usually in one visit, we can, if the tooth needs to come out, we can get the tooth out, do a little bit of grafting, get the implant in, and a lot of times even get a temporary crown on there. Or Morgan's going to show these models. A lot of patients that we see have a lower denture, and nobody likes these things because they just float around down there, but you can get some implants that'll actually snap that in and hold that in place, and that makes a huge difference.
You know, I've seen some of your commercials, and I've seen it down through the years. People with dental issues, Morgan, unable to smile, they just don't feel comfortable smiling, and this can help them a whole lot.
Yes, sir, absolutely. We would love to be able to help you. What we do is some people come in and unable to smile because they're missing a tooth or several teeth, and a lot of times we can just put those right back in there for you.
And this can be a long-term issue that they may have had, or it could have been an accident.
Yes, either one, that is for sure.
Some of the examples you've got, Morgan, talk about some more of that.
Okay, so if you're able to, if you're just missing one single tooth toward the front or even toward the back, we can take just a single implant and place it in between the teeth that are still there, and we can replace that. Some people are missing them from an accident, or some people are even born without them. Mm-hmm. So we're able to put those teeth back in, so you can just smile again like like everybody wants to. Some people already have a traditional denture, such as this one. Mm-hmm. We can take that traditional denture and put implants underneath it so that it'll snap into your mouth. That way it's not just kind of flopping around when you're trying to talk or eat. It makes it a lot easier to be able to do those things such as eating, smiling.
And on the upper denture, if we have enough bone to get in enough implants, you can actually cut the roof of the mouth out of it there.
Yeah, you can take the palate right out.
Which improves the taste and gagging. It helps a tremendous amount.
You know, Dr. Redmond, this is phenomenal. That's going to give people a new life, a new smile.
Yes, it really is very gratifying at the office, because it does. It's to see people, you know, they'll tell us it literally changed their lives, be able to eat again, mm-hmm. and smile without worrying about, you know, a denture falling out or laughing and it coming out loose.
Mini implants, Morgan, is something I'd not heard of until a couple of years ago.
Yes, sir. So the difference is they're so much smaller, so the healing time is so much less. They're a lot less invasive. We can drill a small pilot hole into the bone and just drill it straight down in. You can a lot of times put a temporary on that day with a denture or a crown, and so you're never really without a tooth. We can put one on the day we pull one out.
You know, I've heard stories of implants where it takes months and months and months to get the process completed. Yes. And you're telling me today that the mini implants, there's a possibility that you can get one done same day.
Yes, yes. The healing time, because all you're having to do is one small pilot hole. You're not having to, it's rare that we've got what we call laying a flat, where you got to pull the gums back like you do pretty much on all traditional implants. So the healing is months quicker.
What do you do with Dr. Redmond cowards like me?
Well, we have laughing gas, and we can also give folks, it's like a shorter working form of Valium, but next month we should have our permit to start doing IV sedation. So we'll be able to, folks will come in, they will have already taken something, like I said, like a short acting Valium before they come in. So, because I know even just walking into the office is traumatic for some people. And then actually start them on the laughing gas, and then we can get the IV going, and you'll wake up and it's done.
Morgan, tell me a great story of a success that y'all have had.
Well, one of the ladies came in and she had an upper denture that she absolutely hated. She came in, and because she had enough bone, we were able to replace her upper denture with a fixed bridge. That fixed bridge, once you put it in, it's cemented in, and so you don't have to take it in and out every day, which is really nice. Of course, it's a beautiful porcelain bridge that we're able to take the gum material out completely, so you don't have anything in the roof of your mouth or around the top. It's really nice, and she said that she was able to smile and even eat salad again. So.
Wow, that is fantastic. Dr. Redmond, I know this is something that people are going to ask, so I'll pose it to you. Well, this sounds all well and good, but what about cost?
It's typically about half the cost or more of traditional implants. Wow. Before, gosh, I'd tell, and it's even more expensive now, I'd tell patients, before I started doing implants about 6 years ago, I'd have to send patients to the oral surgeon to have a traditional implant done. And I would tell them to expect at least $3,000 per implant with the oral surgeon, and then they still had to come back to me to get the crown on there. So with traditional implants, you've got a separate cost on the titanium post that you have to screw down the implant that the crown will go on. So I know that's getting technical, but I tell folks, it's going to be about, $4,000 when all's said and done. That used to be. Well, now, 6 years later, we're looking at half that cost.
Wow. Yeah.
So,
what makes a candidate for a possible mini implant? How do we go about that?
The main thing is just to see folks in the office and get that CT. It's rare that there's any medical conditions that will prohibit us from doing implants. It's the most common thing we run into is folks will be on a blood thinner, and normally we'll work with their medical doctor to just have them come off that for a day or two. It does not take much of that at all.
Morgan, you talk about the bone density. Talk about that just a little bit more. Is that older people, younger people, or what?
It can be anybody, and that's why we get to take that hospital grade CT of the mouth, just to kind of make sure that there is enough bone to kind of start with. And even when there's not, we have a way to try to do some bone graft. It may take a little more healing time, but usually by the end we can get an implant in there.
So you could do one single tooth or full mouth?
If the bone allows.
Wow.
And what you were touching on about the bone density, you can't see that very well on the CT, but when you're placing the implant, you get a torque value on how dense that bone is. So in general, older patients, and when I say older, I mean 90 plus.
Why are you looking at me?
No, I'm that, because I know you're not that age group, but I've got, it's 4 or 5 90-year-olds that have wanted implants, and that is, I'm not a salesperson, so they came in asking for them, but I just give them more healing time.
Morgan, what a change it makes in a person's life to be able to, go out in public and spend time with friends and not worry about your teeth flopping around or falling out.
Right.
Yes.
I mean, You know, when I think of my grandparents that had their little teeth sitting in a jar by the bed, I think it's such a huge change
Yeah.
to be able to run around your grandparents' house and not worry about that. You know, you don't have to worry about scaring your grandkids when your teeth fall out.
Well, Dr. Redmond, some people think of it as a joke with the teeth in a glass jar by the table, but it's really not funny to that individual, is it?
It is not. It is. I hear it from patients every day with regular partials and dentures that they'll keep them out most of the time.
Yeah.
They're just
Yeah.
not comfortable for the most part.
So how do we get started with the perspective of someone that is interested in mini implants? What do they need to do next?
They can get on our website, Redmond Family Dentistry in Sylacauga, or call the office, 256-245-3645, and we can get them in for a consultation.
Absolutely.
And I know that you, like me, you write notes, and
Yes.
by the time my ink dries, I can't read half my notes. But some other topics that you want to talk about as far as the mini implants. Have I covered most everything?
I think you've covered most
so.
everything. Usually, folks, you know, it comes down to pain and cost. And I can tell you, we touched on cost. Morgan can back me up on this. Most patients, there's so much less pain with these mini implants. We have a protocol that I learned when I did a year-long implant residency for traditional implants about 6 years ago, and we'll give folks a steroid where you're already numb there, and we'll also give folks some ibuprofen before we start, and it's Morgan tell you, it's like, I don't want to say magic, but soreness is what most folks say they have.
Too, before we go this morning, a lot of people are private. I'm one of those private people. And when I come into a dentist's office or a doctor's office, I don't want everybody knowing my business. You know what I mean?
Yes.
Absolutely.
Yes, and that is not an issue at all. Especially now we've got a much larger office. I'm smiling because I was in Dr. Hollis's office. That was like a little shotgun house, just one hallway and 3 rooms.
You couldn't get away, could you?
That's right. But now we have a private consultation room. We've got some rooms in the very back of the office that is where we're going to do IV sedations, and all the other rooms are towards the front. So yeah, privacy is no problem at all.
Okay, all right. Dr. Rick Redmond, our guest this morning, along with Morgan Ragsdale, who's the implant coordinator. Morgan, I didn't ask you, what kind of background do you have in this type of dentistry?
I actually don't have any at all. I've been with Dr. Redmond for about 6 months. They kind of found me, and I've been with them ever since. I genuinely love my job, and I've learned so much just watching and learning from Dr. Redmond.
So you're a people person?
I think so.
All right,
I would say
that'll
yes.
work out well. Now, soon to be Southern Smiles of Sylacauga, what goes into that change?
Well, of course, I've been practicing for 28 years. It's always just been my name. And then when we were, like I said, blessed enough to have Dr. Casey Price join us, you know, there's always kind of a trial period, but that, like I said, an answered prayer, that is really working out beautifully. So she's officially joining the practice, and we didn't want, we felt like Redmond and Casey was kind of a mouthful, even though we've been kind of using that already. So we decided on Southern Smiles of Sylacauga is what it'll be.
Okay, and that will officially take place sometime soon?
January 1st.
Okay, all right, sounds good. And Dr. Rick Redmond and Morgan Ragsdale of Redmond and Casey Family Dentistry, soon to be Southern Smiles of Sylacauga. Again, before we go today, talk about how people can find out more about the mini implants.
I'd say go to our website, Rick Redmond Family Dentistry, or call the office, and Morgan will be happy to get you in for a consultation.
I sure will.
All right, thank you both for joining us today.
Thank
Thank
you.
you.
All right, we got more Daybreak just ahead. Don't go away.